Hello everyone. Today I want to discuss an important topic for ADC exam, which is acute odontogenic infection. For this, you have to read therapeutic guidelines very well, and this is a very confusing topic when it comes to different types of odontogenic infections. So I'll try to explain it in a simpler way. So coming to acute odontogenic infections, it is mainly due to three reasons. It can be because of developed from dental pulp, okay, or either from periodontal disease or pericoronal tissues. So odontogenic infections can affect what all dental pulp, periodontal tissue, and pericoronal tissues. You should remember this. Then this can be in different forms. Mainly, it can be categorized into three forms, that is, localized odontogenic infection, spreading odontogenic infection without severe or systemic features, then spreading odontogenic infection with severe or systemic features. So, what are the three types of odontogenic infections? Acute odontogenic infections mainly localized, spreading odontogenic infection without severe or systemic features, and spreading odontogenic infection with severe or systemic features. So how to differentiate? What are the differences of these three type of infection in terms of their clinical features and management? Now I am going to explain that. So this is a table which is given in therapeutic guidelines. This you have to remember very well. So first one is the localized odontogenic infection. So localized odontogenic infection, I will give an example. It will look like this, something like this. That means the patient will have usually will have dental. It is an acute infection. I already told it is acute odontogenic infection. Acute means it it will be painful. It happened in a short duration of time. So dental pain is common in all the three types of acute odontogenic infections, whether it is localized or spreading infection with or without systemic features. Okay. So localized odontogenic infection, there will be localized swelling, abscess, which look like this. You can see it here. Here this tooth is decayed, dental caries, and because of that an abscess is formed on the gum. So pus can be visible, may be visible, but the difference, you should remember this, even though pus is there, there is no facial swelling and no severe or systemic features. We have seen many cases in our clinics when there is an dental caries or because of any reason or periodontal disease or any reason there is an abscess and the patient has pain, but there is no facial swelling or no systemic or severe any features. So this is considered as localized odontogenic infection. So what is the treatment? Treatment is outpatient dental treatment. Okay. And is there any need of antibiotics? Normally, no, no need of antibiotics. Only outpatient dental treatment is enough. But if treatment is not received in 24 hours, then antibiotic therapy is necessary. So this you should remember. What? That is a localized odontogenic infection. There is usually only need of outpatient dental treatment and no need of antibiotics. And if dental treatment is not received in 24 hours, then you have to give antibiotics. That is usually given by a medical practitioner. A medical practitioner is not able to, medical practitioner told the patient to go to a dentist, but then also if he is not able to go within 24 hours, the medical practitioner can prescribe antibiotics. Coming to the next one, which is a spreading odontogenic infection without severe or systemic features. So it is a, I didn't get a proper picture. So this is just for reference. The patient has important feature is facial swelling. Patient has got a swelling, and there will be, since it is an acute condition, there will be dental or facial pain, and abscess can also be there. Pus, like the same like odontogenic infection, pus may be visible, but there is no systemic or severe features. In the name itself, you should remember this, without systemic or severe features. So the main differences you should remember is this: patient has got a facial swelling. So what can be the treatment? The outpatient dental treatment followed by oral antibiotic therapy. In localized infection, we have told no need for antibiotic therapy if it is a localized infection, and treatment will be received within 24 hours. If in this case, if there is a spreading odontogenic infection without severe or systemic features, we need antibiotic. Oral antibiotic therapy is necessary for spreading odontogenic infection. And if dental treatment is not received within 24 hours, medical practitioners can start antibiotic therapy. But we have to ensure that the patient receives a dental treatment. So what is the main difference from the spreading odontogenic without severe features and the localized infection? The main difference is in spreading odontogenic infection without severe features, there is facial swelling, which was not in localized infection, and the treatment we have to give oral antibiotics. Now coming to spreading odontogenic infection with the main differences with severe or systemic features. You can see the difference here. The patient has got severe features like significant facial swelling. It is not just facial swelling, it is significant facial swelling, pain, trismus, neck swelling, difficulty swallowing, difficulty breathing, airway compromise. Once you look at this patient, you will understand. You can see this side of the right side of the patient's face, there is significant facial swelling, and there is a we are sure in this patient the patient will have difficulty swallowing, difficulty breathing. From the uh, patient's face itself, we are able to understand that significant facial swelling and features associated with that. And there will be systemic features like pallor, sweating, tachycardia, and accelerate temperature above 38. You have to remember this: 38 degrees Celsius. So patient will have a fever and tachycardia along with difficulty in breathing, airway. If patient has any of these symptoms like temperature high or a severe facial swelling, then it will come under spreading odontogenic infection with severe or systemic features. So what are the treatment options? Treatment option is to provide appropriate, because patient has breathing difficulty, airway, breathing and circulation support we have to provide. And you should remember this: urgent transfer to a hospital with an oral and maxillofacial surgeon or other appropriate expert. So you have to remember this: urgent transfer to the hospital. Then surgical intervention is needed along with IV antibiotic therapy. So the major difference in this is a significant facial swelling, and the temperature will be above 38 degrees Celsius, and all this difficult facial features, difficulty in swelling. And we need in the treatment, we need to refer the patient urgent transfer to a hospital, and IV antibiotics. You have to remember IV antibiotics. Then I made a table to make this very easy. So I have given localized infection as spreading odontogenic without severe or systemic features, and spreading odontogenic infection with severe features as headings for the table. So pain will be, since all these are acute conditions, pain will be present in all three conditions, and facial swelling is not present in localized, and there is facial swelling in spreading odontogenic infection without severe or systemic features, and spreading odontogenic infection with severe features like we already know there is significant, I'm sorry for my handwriting, significant facial swelling is present in the spreading odontogenic infection with severe or systemic features. So in this it is already written significant facial swelling. Then coming to neck swelling, difficulty swallowing, everything is absent in both these situations, while it is present only in spreading odontogenic infection with severe or systemic features. Coming to the treatment, Both these conditions will can be usually treated by outpatient dental treatment, while with severe or systemic features need urgent hospital transfer. Antibiotics is usually not necessary for localized or acute odontogenic infection, and it is needed if treatment is not likely to be received within 24 hours. While antibiotic therapy is necessary, always necessary for spreading odontogenic infection. It is always necessary in spreading odontogenic infection, but the only difference is without severe or systemic features there is need of oral antibiotics, and if it is a spreading odontogenic infection with significant swelling and fever with severe systemic features, then the antibiotics we will give is IV antibiotics. Not it is not we dentist will give. We will refer the patient to a hospital or where there is a oral maxillofacial surgeon is there, so they will give IV antibiotics. It's not us, but the line of treatment is IV antibiotics, not oral antibiotics usually, because it is a severe or emergency case. So I think this made it very easy to understand the difference between these three acute odontogenic infections regarding its clinical features and management. So if you need any topics for further understanding or any discussion, you can always mention it in the comment box. Thank you.